Now, we know the national death toll from the coronavirus is 361, but there are grave fears that hundreds of other lives have been lost or imperilled by our response to the pandemic. The Cancer Council and other cancer institutes are collecting data that shows that in Victoria alone, cancer pathology notifications are down by more than 100 people a day, or down by more than a quarter, essentially because people are not getting tests done. Around the world, there are fears and growing data that show if pandemic restrictions or our fears of the virus keep us away from medical appointments, more of us will die from heart disease, other ailments and, of course, cancer. Dr. David Speakman is the Chief Medical Officer with the internationally renowned Peter MacCallum Cancer Centre in Melbourne, and I spoke to him a short time ago. David Speakman, thanks so much for joining us. We hear a lot about the mental health implications of the lockdowns that we're going through around the country, especially in Victoria at the moment. What are the implications for other health conditions, especially cancers?
Well, thanks, Chris. I think they're fairly significant, actually. We know that a lot of people, very understandably, don't want to leave their homes and don't want to go and see the doctor. And that's meaning some people are ignoring symptoms and signs that might indicate things like cancer. And that's a big issue, because if we're unable to treat the cancers early on, then that risks the patient being in a far worse position when they actually do get to the doctor. It may indeed, in some cases, mean that we are unable to treat the cancer as we would normally do so, and certainly would bring the potential that some people might not get a good outcome from their cancer. So we're very keen that people understand, despite the anxiety, that we can safely assess them and sort out their problems, be they cancer or other significant medical issues, despite the COVID pandemic. I think we've been really lucky to have a huge surge in telehealth, so people being able to connect either by video or by phone with their doctors to get problems sorted out. And it's meant that there's been a great change in the way we do things, which actually will bring about a lot of benefits in the long run, I think.
Well, we've been dealing with this pandemic at a number of different levels for close to 6 months now. There has been some data gathered, hasn't there? I know the Cancer Council and other institutions are looking at the data here. Is it fair to say that we can see already that some cancers are getting away? We are seeing fatalities now because of that lack of early attention.
We can certainly see from some excellent data provided by the Cancer Council of Victoria and also Cancer Australia that there's about a 40% drop-off in the cancer referrals that we would normally see at this time of year. So that's a very significant swing, and we would expect that would have an impact on the stage at which cancer was presenting. And indeed, we've seen that a lot of the cases we're seeing now are a bit more progressed, and therefore that actually makes them a bit harder to treat and brings COVID into play even more. If we're able to treat these problems early, then we can avoid some of the things that might, the immunosuppression that might put you at risk during treatment. And so that's why we're so keen that people don't delay and that they seek help from their GP or specialist hospitals or anyone else that they might need. Because, as we said, there's plenty of ways to do that without putting yourself at any risk from COVID.
Have you been able to quantify lives imperilled or lives lost at this stage?
I think that it's very hard to say that at this point. If we look overseas, there's certainly been lives lost due to the pandemic causing people not to seek attention. We've been fortunate, obviously in Australia, that things have not been quite as bad as overseas. So it's hard to put a number on that at the minute, but we certainly fear, just as we're fearing the second and third waves of COVID, that there'll be a wave of diagnoses of cancer and a whole lot of other medical conditions that have been missed or not attended to because of the pandemic.
So your message to people is if they're worried about a lump or they're worried about a growth on their skin or something that they would normally go and get checked out by a doctor, they should go ahead and do that they can be made safe in a COVID environment. But my other concern on this is that some specialist treatments and other minor medical procedures are being delayed. Patients are being told that these appointments are no longer going to be taken. And therefore some regular checkups on ongoing ailments, some of them linked to cancer, are not occurring. And so that even if people want to see their specialist, it's not happening.
So I think that's right. Everyone, it's a changing landscape with COVID, and so everyone's screening programs are trying to adapt and to still be able to provide a service, but making sure that that's balanced against the risks of COVID. I think, for example, the breast screening program has made a number of changes to how that's done so that patients can still go along and get their regular checks. Same with the bowel screening program. That can all be done at home and posted off. So we should be absolutely pursuing that. And then if you do need a colonoscopy, for example, down the road, that's absolutely able to be performed in hospitals or day surgeries in a completely safe fashion. And I think the risk of not getting checked far outweighs, in fact, any possible risk from COVID. We've got excellent protocols in place, personal protective equipment, all sorts of social distancing measures to make sure that the patients who are in our care are kept completely safe. And I think you've highlighted one of the most important things about COVID, and that's communication. So whether you communicate with your GP or your specialist by phone, by telehealth or face-to-face, it's very important that you do that rather than neglect things and let them get to a worse state.
This is a major issue, though, isn't it, David? Because we're only 6 months into this. There may not be a vaccine for years, maybe ever. We do need to learn how to live with the virus, and this is going to have to be a very big part of that. We're going to have to make sure we get back to something approaching normal medical scrutiny and treatments.
You're absolutely correct, and I think one of the great things about the human nature is that we're able to adapt and that we will find ways. As I mentioned about telehealth, it's exploded as it should, but we're able to do it in a very safe way. So I think we'll see the health system adapt more and more as the pandemic goes on, and indeed as we learn to live with COVID.
Well, it's a deeply worrying situation, I think, and I thank you for drawing our attention to it. What's going to happen next? Is it a communication plan? Is it more flexibility within the medical profession? Does the government need to step in? And we're talking here about lives being lost, lives being under threat because of people's reticence or inability to get the specialist care they need.
So I think you're right. I think the first step is to reassure people that we can look after them safely and that they shouldn't sit on these problems. And I think we're well on the way to doing that. And this type of exchange is just the start of that program.
Thanks so much for joining us. I appreciate it. Very important story that. We'll keep on that, but it's a good reminder to all of us too to make sure we're still getting that medical attention that we need during this pandemic.